Welcome back to Mountain Health. Today we're talking to Scott Baker, Vice President of Provider Services over at Tahoe Forest Health System. We left off talking a little bit about orthopedic services and anterior hips and all kinds of fix-it programs there, but what's the difference with orthopedics versus sports medicine? We hear the two used very often in the same conversation. What's the difference?
In general, there's some nuances, but in general, sports medicine deals with the non-surgical aspect of these type of injuries. Orthopedic gets into the more interventional surgical programs, but sports medicine and orthopedics overlap a lot, and that's why we have an integrated program to take advantage of all those skills.
I know physical therapy, which I've referred to as PT, I apologize. Physical therapy is a part of both, but very important in sports medicine.
That's correct. For pre and post surgery, many injuries don't need surgery.
Why is it important in pre? I mean, what does that program look like? How long does it last?
Well, a couple reasons. One is to, in some cases, get patients ready from a physical standpoint to endure what happens after a surgery. But in many cases, it has to do with the rehab of physical therapy back to getting to patients to where they were pre-surgery. So anytime you put new hardware in the body, you've got to relearn how to move and get the muscles strengthened to the point where it can support that, and that's a big part of the program in general.
But if you're doing physical therapy prior to a surgical event, your recovery time is improved?
That's right. Not only do you learn the skills of doing the physical therapy, you learn the movements and you learn how to do them ahead of time, but you also build the muscular strength around the joint to make the recovery much faster.
So you're not starting from zero.
Exactly.
In addition, sometimes geometry changes. You've got to learn how to adapt to that.
That's right. That's true. With the anterior hip program, because we're not manipulating the muscular structure, that's a little bit less of an issue. But still, anytime you get in there and move things around, things will change, and that's part of the physical therapy of learning how to move again with the new hardware.
Also, sports medicine, you've got a lot of local athletes.
That's right.
A lot of different athletic ventures. You've got anything from rock climbing, snowboarding, skiing, cross-country skiing, and all kinds of different injuries there. You can take them all?
Absolutely. Soup to nuts, anything that comes in the door for the most part. There are some very specialized procedures that we do refer out, such as spine and things of that nature, but for the most part, we can take care of most of the patients that come through the door. And we do have integrated providers going into the schools to help with those athletic programs. We have athletic trainers that go out to many of the high school sporting events to take care of patients that might get injured there. Our sports medicine physician, Nina Winans, goes out to the community quite a bit. And we, like I mentioned earlier, we have integrated programs with many of the ski hills, the freestyle programs and other ski programs on all the ski hills.
So I would imagine in sports you're going to see some uniformity to the injuries. Sure. What about traumatic orthopedic injuries?
All of our physicians are trained in trauma, take care of trauma cases. One of our physicians has a fellowship in traumatology, so we have those high level of skills in-house. And just by nature of taking call 24/7, we get everything from ski hill injuries to slipping on the ice to some motor vehicle accidents or snowmobile accidents that are not sport related but still carry those type of injuries that we need to be able to take care of.
How does one access the orthopedic and the sports medicine program? Maybe they don't have an injury yet. Maybe they are working through a longer term injury that they've carried for many years. How do they access you? Where do they start?
Sure. The easiest way is if they have a question, if they think they might need our orthopedic or sports medicine program, is to see one of their primary care physicians, to go to their primary care and say, this is what's going on. What's the best way to deal with it? And primary care is an outreach of our orthopedic and sports medicine program. They are an outreach for us, and they can take care of some of the injuries, and if they don't feel comfortable or it's not appropriate, then they refer to our program. The other way is just to simply call the main hospital number, and they can put you in touch with the appropriate person to schedule for that specific situation.
And that can be a step program, so if your primary care physician refers you to another physician for evaluation?
Sure.
And if they see something, then you would go
That's right.
Perhaps to imaging or something like that?
That's right. Your primary care physician can say, yes, you've definitely got something going on. In some cases, they'll order the image and the referral to whoever's appropriate, sports medicine, physical therapy, orthopedics, whatever the case is. And that way, by the time you get to that appointment, they have all the information they need. Our orthopedic program has x-ray on site, so they can always refer directly to that program and take care of that when you get to their appointment.
To be fair, very often, you might be referred right to physical therapy because you might be able to solve your own problem.
That's right.
Without surgery.
That's right. And again, our system as a whole, with our primary care physicians being very knowledgeable in this area because they have integrated with our program, they can sometimes refer straight to physical therapy and take care of it that way.
And I've been that route. It's surprising how much you can do with physical therapy,
right,
in avoidance of surgery. You've got quite a team. What do you anticipate in terms of growth of that team over the next, say, 5 years?
I think we'll see more and more integration into the school systems, the ski programs, the athletic programs around the region.
Preventative?
Preventative for sure. Educating the population on how to prevent it. That's a big part of the program, is not just taking care of patients after the injury, but preventing those injuries. Our program with Squaw Valley, for example, is teaching students the correct movement and biomechanics so they don't injure themselves. And we have a lot of those programs out in the community now, and that's a big part of it.
Well, Scott, thank you very much for joining us today. You've been watching Mountain Health Today. Our guest, Scott Baker, Vice President of Provider Services. We've been talking all things orthopedics. Thank you for joining us, and we'll be back and see you another day. Welcome back to Mountain Health Today. I'm Ted Owens, your host, and we're talking with Scott Baker, Vice President of Provider Services at the Tahoe Forest Health System, and we're talking about orthopedics and orthopedic service lines. When we broke for the break there, we had just kind of started talking about anterior hip replacements. What is that, so the folks at home understand that it's a deviation, a strong deviation from traditional hip replacements?
Sure. So anterior just means they approach the hip from the front, and that has a few advantages. One, the incision to get into the hip is much smaller, and in most cases just a few inches. But the big advantage is that it goes in through the front, and therefore they don't have to manipulate the muscular structure of the hip nearly as much as the other approaches. So they leave the muscular structure intact, which for the hip, the type of joint that it is the utmost importance for a successful and quick recovery to that.
Far less invasive.
That's right, far less invasive, and the recovery times are much shorter. We can often do a full hip replacement in the morning. They can be up and walking after lunch and be home for dinner.
Now that is an incredible difference from the older methodology where people were, I mean, what did that look like? You know, PT for 4 weeks, walking in 6.
Right. Many of the old methods required many nights over in the hospital, 3-4 nights in many cases, bedridden for many more days in some cases, as well as some pretty harsh and painful PT. But now we can get people back to their sports in a matter of weeks instead of a matter of months, and they can recover at home where it's much more comfortable and advantageous for them. Our PT program does pre-screenings with them, pre-exercises with them to get them ready, and then they can immediately start doing that within days after their surgery, and oftentimes return to a normal life, if not a better life, than they had pre-surgery.
Now, anterior hip replacement is not just something you turn a light switch on and you start doing tomorrow.
Correct.
It takes a commitment in terms of the equipment, a specialized table, correct?
Special table, special equipment, special training, special support staff. The entire program is different for anterior hip replacement because it includes, like I said, PT up front so that they're ready to do it on the back end. The nurses have to be specially trained. The tools are different. The tables are different. So it's a full program that is really state of the art.
And the orthopedist, of course,
That's right.
highly educated and committed to that program.
That's right.
Let's talk about what kind of stuff do you hear? Do you get feedback that makes it to you?
I do, yeah.
About the program?
A lot. Our community is very active. In fact, one of the conversations that happens a lot with our surgical specialties are that in many areas of the country, they have to motivate the patients to get up and start using their new hardware after the surgery. And in our community, we have to temper that. We have to tell them to take a couple of days off before they try to use it. So they want to get back out there and enjoy the life that we have here in Tahoe. And we get that feedback all the time that not only do they get back out there quicker, but they have a better life and better quality of life after the surgery because they were dealing with something that was broken for a long time before the surgery.
And I think that's the difference. I think a lot of people in different communities aren't active. So, you know, you have that issue when they're post-surgery.
That's right.
They're going back to inactivity, which is probably part of the problem. Our folks who are active, cause of the problem, want to get back out there doing what they love.
That's right.
Some of your orthopedists are those kind of folks too.
That's right. You'll see them out there on the ski hills and on the trails and in the water doing what they love to do.
And other activities I understand too, like off-road vehicle driving, and
that's right. Yeah.
at least they can take care of each other if they need to.
That's right.
That's good.
They've got good referrals.
So you said earlier that you've expanded the program, but you're still not meeting the need.
That's correct.
So what does the future look like? What are you seeing?
We're looking at other opportunities to bring more resources into our clinic in the form of additional providers of different types to make sure that we can meet that capacity. We have plans to build an even larger state-of-the-art facility to include an outpatient surgery center as well as a much larger clinic for both our orthopedic and sports medicine clinic, but as well as our PT as those programs all grow.
Tell me, that's an integrated program.
Correct, yeah.
That's a model that does exist other places. Why is that important? Why is that important to the folk at home?
It's important because as soon as a patient is identified as an orthopedic or sports medicine patient, the continuum of care doesn't stop with a clinic visit or with a surgery. It starts wherever that patient came into the organization, whether it be primary care or brought in on a stretcher from the ski hill. From that point forward, it's an integrated program until they're back doing their normal activities of daily living, if not returning to their extreme sports or whatever got them there in the first place. So it's important to have all those resources in the same place.
And the growth that we're seeing, we had in another episode, I was talking with Harry Weiss about past growth, planning for it, planning for future growth.
Yeah.
You mentioned trying to integrate all in one location. I know that you can't go into specifics on that. It's still on the chalkboard.
Sure.
But that's what you're talking about essentially, is planning for the next decade, the next 20 years.
That's right. It's very conceivable we'll more than double our growth again over the next 5 to 10 years, and we need to plan our facilities according. And there's changes in healthcare that we need to plan for, from payer reimbursement to new types of services, new surgery techniques, and we'll continue to support that as they come out, and we train our facilities to do so.
Are you finding that your patient mix, is the age going up, is the age low, or is it generally just all across the board and constant? Young, extreme athletes, for example, older warriors like myself.
Sure.
What do you see?
We see a mixed bag across the board. As you mentioned earlier, our population in general is aging, so we see that population growing, but we also see a lot more people coming up here and doing some extreme sports. There's a lot of training facilities that are growing up here, and we're supporting those programs. The ski programs and all the ski hills are growing, and we're integrated with those and supporting those programs as well. So almost every segment of our population is growing.
Really pushing to get out there, particularly with the athletes.
That's right.
Semi-pro and pro.
That's right.
I also understand that our orthopedists see all kinds of different things, different injuries. Mm-hmm. We're going to talk about that in the next segment. This is Tahoe Forest Health System, Vice President of Provider Services, Mountain Health Today. We'll be back in just a minute. Welcome back to Mountain Health Today. I'm Ted Owens, your host, and today I have with me Scott Baker, who's Vice President of Provider Services in the Tahoe Forest Health System. Scott, thank you very much for being here and welcome.
Thanks for having me.
Good to have you here. Scott, before we go into this, give me a little bit of background about yourself. You've been with the system for a little while. Have you enjoyed it so far? Have we kept you busy?
Very busy and absolutely loving it here. I came on in 2016, so I've been here for a little over 3 years, and we've experienced some tremendous growth and done a lot of great work, and it's been fun to be here.
You've been a key part of a lot of that growth, filling the gaps, providers, planning for the future, and kept you quite busy.
Very.
So let's talk a little bit about orthopedics today. Tahoe Forest has had an orthopedics and physical therapy program, sports medicine program for some time, but it's grown quite a bit under your leadership. Share with us what you found when you got here and how it's changed.
Sure. Shortly before I arrived, the previous independent orthopedic group had formally joined the health system in 2015, and so in 2016 it was part of my control when I came into the organization, and it's grown substantially since then. We now have 4 orthopedic surgeons, an additional orthopedic physician that does some community outreach for us, as well as a sports medicine physician, 5 physician's assistants that are integral to the system, as well as a long list of nurses and techs and MAs and schedulers and everybody else that supports the program.
And also it's important to point out that's not just including the Tahoe Forest Health System located in Truckee.
That's correct.
But you've also had to expand services over at Incline Village.
Correct. In 2019, we expanded our services to Incline Village with one of our orthopedic surgeons who sees patients there, as well as does surgery in our sister hospital there in Incline Village.
And that was that a program that was lacking or non-existent when you arrived?
There were orthopedic services there, but we felt that our patients, as we grow our other service lines, namely primary care and other services in the Incline Village community, that we also wanted to support orthopedic patients there. So we expanded there in 2019. It's been going very well.
Now, our community in the North Lake Tahoe area is changing. We know the fastest growing demographic is 65 and older.
Sure.
People come here to do the kinds of things, the kinds of activities that might require a tune-up with orthopedics from time to time.
That's right.
In the area, it's grown. You brought some talent in from out of the area. Share with us, how'd you go about that, looking for some new talent?
Yeah, so we've added 2 additional orthopedic surgeons over the last couple of years. Both of them came from fellowship-trained programs that specialize in what we do here, and that's general orthopedics, everything from trauma to full joint replacement. So we've concentrated our search there and brought in some really talented people over the last couple of years.
Not to mention the fact that you already had some talented people here,
Of course,
but the capacity was what had to be met.
We're still not meeting the demands of the community. The community is growing, as you mentioned, and we're trying to just keep up with that growth.
Is it a challenge to try and find that type of orthopedist to come to a region like ours? Not everyone likes snow.
Sure.
We'd like to believe that they would, but not everybody is into that. But also people that are multifaceted, multi-skilled.
That's
correct?
right. That's right. Yeah, we have to search for people who are comfortable doing everything that walks in the door, from a snowmobile running into a tree to people falling on the ice to full hip replacements just due to the aging population. So we do have to look carefully for those people with those skills, and not everybody wants to do that, and not everybody wants to live in a community that gets hundreds of inches of snow every year. But they're out there, and when it's a good match, it's a good match, and they tend to stay for a very long time.
Well, not everybody wants to be a part of the aging community, as I am, but I've had a shoulder done as well. So there are a lot of services that were provided before. One of the things I think that was interesting was the anterior hip procedure.
That's right.
Tahoe Forest was one of the first regionally to, if not the first, to offer that. Correct?
That's right. Among the first in the region, and we do many of them every year, and we'll talk more about that later, but it's a very specialized approach. It's the latest and greatest, and it's tried and true to improve recovery time and get people back to doing what they like and enjoying their lives.
So along those lines, you're striving also to do state-of-the-art work.
That's right.
Provision of state-of-the-art equipment in order to do that work, and we'll talk about that in greater detail. Not really part of what you are in the provider services part, but finding the talent that's equipped and educated to do it.
That's right. The physicians that we search for and employ in the clinics are the ones who do the surgeries in our facilities in the hospital. So we have to make sure that they match both the clinic need in the community as well as the surgical need in the hospital.
Okay. You're watching Mountain Health Today. My guest is Scott Baker, who is the Vice President of Provider Services for the Tahoe Forest Health System. Scott and I will be back in just a moment. Welcome to Mountain Health Today. I'm Ted Owens, your host. Mountain Health Today is a program about all things healthcare and important to the community that we serve. You can see us on Lake Tahoe TV in the Truckee area on Channel 14, North Lake Tahoe, Channel 195, South Lake Tahoe, Channel 12. And of course, all programs are available on tfhd.com. This is Mountain Health Today, and we'll be back in just a moment.